Hey everyone, this is Kitty Clinical here with another video. I wanted to do a jumping off point on the adult cardiac arrest algorithm. I know I made a huge deal about this in a previous video where I talked about how to run a code blue. I want to talk about pushing epi because this is something very important that you should understand, you should know as a resident, as a physician. When a code blue is being called on the announcer, you're going to the code. How long does it take to go from the call room to the patient's room for a code? Probably takes about a minute or two, right? So by that time, let's say CPR, they started CPR already. Chances are you go in and there's nobody running the code, or it's all nurses, or it's people who are running the code who are CPR certified, and they're doing CPR. They're checking for a pulse. And what happens after 2 minutes of CPR? What happens after they do a pulse check, right? Look at the algorithm. Almost always you'll see epi, 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 epi. Asystole PA, push epi ASAP. VFib, VTAC, 2 minutes of CPR, get IV IO access. Rhythm shockable, yes, shock. Epi every 3 to 5 minutes. So you're probably pushing epi, right? Whether it's 2 minutes for asystole or 4 minutes for VFib, VTAC, you're giving epi. And so if you want to push epi, if nobody's pushed epi yet, you feel free to pull the trigger and push the epi. If you're probably not wrong by doing that. You're not going to be wrong by doing that because they need epi. You're trying to save their life. Don't forget about the epi. I've had many times there have been people who run codes, or maybe like interns, right, or late interns who run codes and they forget to push the epi. Please do it, because that's what you're supposed to do. That's what saves the patient's life. On top of the CPR and the good compressions, right? Give compressions, gives epi, and it's epi every 3 to 5 minutes. So if you want to keep it simple, you can do 2 rounds of CPR 2 minutes and then push epi. CPR 2 minutes, CPR 2 minutes, epi, CPR 2 minutes, CPR 2 minutes, epi. Hopefully that is helpful. I just wanted to give you some tips, some tricks of the trade for running a rapid, and one of the first things you should be looking out for. One of the first things you should be looking out for is definitely looking at the code status. But on top of that, if once you establish that they're full code, they should have ideally done that already. Is look at make sure that they've already pushed epi.